Okay, so I have no relevant disclosures, and the concept of diversity, equity, inclusion have been getting a lot of attention. And I know Stanford has very active committees and group to promote awareness on that topic. So I wanted to make this more of a interactive grand round this morning. So if people who are sitting in the back could kind of come down, if you don't mind, I really appreciate it, so that we can kind of all participate, because I don't necessarily think I have new ideas per se, but I want to just make this into a discussion and chat. So, and so the first thing I want to talk about is, hopefully at the end of this talk, everyone can recognize that a motivated and successful team is made up of many motivated, successful me. And understanding the power that we have as an individual that makes up that team is very important. And also, hopefully you can describe best practices to minimize hindrance to the best of me and the team. Okay, so let's start. Team. What is a team? When people say, let's join the team, what does that mean to you? Anyone?
For the common vision.
Yes. So thank you, Dr. So I like that you said common vision or common goal. So team is not same as a group per se, because in a team, right? It's a collection of people with complementary skills who's committed to a common goal, common vision. You have a purpose. You have something to achieve, right? It's also in that work group team, people rely on collaboration if everyone needs to be successful and have experience to optimize the productivity. So in a team, you have a group of people who's different, but the end goal and end vision and your mission, you share the values and vision and mission. So what makes a great team? What is your ideal team for you? What are some of the traits, right? We're all in a team, right? You're in clinical team, you're in your resident team, right? So what makes a great team?
Good communication.
Good communication, perfect. What else? What would you like to see in your team? Trust, good. Productivity, yes. You want everyone to participate and achieve the goal, right? Achieve that productivity. What else? Okay, so in other words, diversity, right? You don't want everyone having the same skill per se, right? You want diversity in your team. What else? Yes, clear, defined goals, good. And goals. Also, you want everyone to have fun, right? Good team. When you're in a good team, you want your team to have everyone to have fun, everyone to participate, everyone to contribute. Okay, so let's talk about diversity, right? You don't want everyone in the team to do the same thing, have same ability, right? Have same ideas. Great team, part of being great team is that they foster diversity and they appreciate diversity. So what does diversity mean to you? When somebody says, my team has good diversity, what does that mean? Is it just gender diversity, age, goals? Life experiences, right? So if you see the slide, there are different levels or dimensions of diversity. So the diagram you see is called diversity wheel. So certain diversity such as gender, right, age, your ethnicity, those inherent primary characteristics you cannot change. But other part of diversity, right, your education, your socioeconomic status, your religion, political view, certain things are mutable that can be changed. If everyone's seeing this slide, does anyone know what this slide represents? What does the slide on the left, the puzzle pieces, just hanging out? What does that, what do you think that means? So that slide, actually, that picture it's representing diversity, right? You have a lot of different colors, a lot of different shapes, right? They're kind of together, and it represents sort of a broad spectrum of differences. In turn, when all the puzzle pieces are put together, what do you think that represents? Since we're talking about
A team.
a team, yes, but it's actually inclusion. But right, we want a inclusive diversity in a great team. So diversity is having this, differences that we appreciate, but inclusion is something different, right? Inclusion is putting that diversity together so that it creates a set of culture or behaviors that encourages, your team members, your employees, co-workers, colleagues to value these qualities and to put that to work. So you can see diversity, it's easy to bring diversity, but you have to actively participate to achieve inclusion, right? These puzzle pieces are not going to just come together by themselves, right? So creating this inclusive diversity or inclusion in your team, it's everyone's responsibility, and it takes an effort because inclusion just doesn't happen. How about this picture? I know probably a lot of people have seen this picture as well, right? What does the picture in the left mean? Everyone has a step stool, right? Equality, right? So equality means everyone gets same thing, right? Giving everyone the same step stool. But equality doesn't mean fairness, right? Because in that picture, you've left somebody out in your team. That person doesn't have access to watch the game. On the other hand, what does that picture on the right represent? Equity, yes. I knew you guys were smart. So equity means fairness, right? So giving everyone access to the same opportunity. So in that picture now, everyone can watch the game. But as you can see, someone had to give up their step stool, right? And someone probably had to raise their voice to bring that ramp so the person on the wheelchair could watch the game, right? So same thing, equity, we all talk about equity, and it's a great concept, right? It promotes collaboration, right? Sense of belonging, but equity just doesn't happen, right? Somebody has to speak up and stand up for those people who may not have the same opportunity or same access. So if you're in a team, right, which team would you like to belong to? The team that gives you equal access, or a team that actually practices equity, right? Think about the team that you would rather belong to. So when you put diversity, equity, inclusion together and you make it really work, then it creates sense of belonging for your team members and your group, right? The group that shares same goal and vision and mission. So we've all heard of the saying, right? Your team is only as strong as the weakest chain, right? So when we foster these diversity, equity, inclusion, we're ensuring that all the chain or all the links in your chain has the same opportunities so that you don't lose a good chain, good link, and create a weakness in your team. So next thing I want to talk about is about you being in a team as a team member, right? So in the book From Good to Great by Jim Collins, he talks about 5 levels of leadership. So in your team, I think one thing we didn't mention is for a great team to happen, you also need to have a strong leader, right? That earns trust and respect. Being a leader is not something that you're born with. Leadership skills are something that you can learn and refine and practice. That's why there's so many sessions, right? All these lectures on leadership skills. There's so many books on them because we really do think that great leaders can be raised. So if you look at this diagram, level 1 is highly capable individual. So in the team, right? If you have 10 people in a team, not all 10 people can be, sorry about that. Not all 10 people can be a leader, right? You have to have a strong leader, but you also have to have good followers. So when we talk about a team and when we think of team members, teammates at individual level, you can kind of figure out where you are in your group. So there's nothing wrong in being a highly capable individual in your team, right? And getting the job done. But as you move along your life's journey, right? Because we grow old, we become wiser and mature. Hopefully your leadership skills or your life skills will improve. So right now you may be an intern or medical student and you're great at doing the job or the task that's given to you. But as you become a senior resident, you become junior faculty, as you become mid-career faculty and senior faculty, the expectation is that through your life experience, as you grow wiser and you gain more experience, you'll go up the levels of this leadership pyramid. But one thing I want to point out is that they specifically distinguish level 5 executive leaders versus the rest. And the reason that they distinguish level 5 is that there's this paradoxical blending or concept. These people are ambitious, right? In order to be at the pinnacle of your organization, to be this top leader, you have to be skilled and you have to be ambitious. But they don't channel this ambition into their own gain. These are people who channels their ability and their ambition into making the team great. So there are great mentors, great coaches. They put other people, they sponsor other people, they give others credit. But when things happen, when they face problem as a leader, they'll take the responsibility. So as a team members, we want a great team. And it's okay, depending on where you are, we're all highly capable, right? Highly driven individual. But remember, as you go through different phases of your training and your life's journey, hopefully you'll grow as a leader, as a contributing member, and think about what level of leadership you want to achieve. And when we face these difficulties, which we all do, right? We have the lowest moment in our lives, and you think it's the lowest, but it may not be. And you have the highest peak in your life, and it may not be, because life is long, right? You never know what you're going to face in the future. And as a team member, you want to be there for your colleagues, and you want to create a supportive system. So I chose this article partially because as physicians, some of the lowest moments are when we have bad complications, right? You kind of blame yourself, or you look back and say, oh, I shouldn't have done that, or what could I have done differently, right? And when you have those low moments, and sometimes you have moments of self-doubt, the survey suggests that a lot of physicians, the way they cope with those negative emotions is by talking to colleagues, right? Just talking to them and see how you could improve things, or somebody just telling you it's okay, right? I've been there. What you're feeling is absolutely normal. So in order for us to have a great team, we have great people making up that team, and those people needs to be supportive of one another. and willing to provide the services that help when others need them. So when people need help, we want to make sure that we know what we're doing, right? Because sometimes we can have the best intention, but the outcome may not be what you expected, right? So let's talk about how not to cause more harms unintentionally or compound more problems. So first, I want to just go over golden rule versus platinum rule. I'm sure everyone have heard golden rule, right? It goes back to the biblical time, right? Golden rule states, treat others as you want to be treated as yourself, which sounds great. It makes sense. And actually, that's what I thought I was supposed to be doing until I was kind of looking into more on this topic and learning more about how I could improve when I help other people. So now there's this concept of platinum rule, right? So which one's more expensive, platinum or gold? Platinum, right? So it must be a little better than golden rule. And platinum rule says, treat others the way they like to be treated. So it's not what I think is best for that other person, or, it's not doing me doing things I think I would like to be treated, but you kind of understand what that other person is needing, and you learn about their triggers, you learn about their differences, and you're treating them the way they like to be treated. So it's important for us to be aware of ourselves and our triggers, our hot buttons. But when you work in a team, it's also important for you to be aware of those around you, what their hot triggers are and what their hot buttons are, right? Because you don't want to create conflicts, problems intentionally or unintentionally. The other thing when you are talking to people around you is to be aware of your biases, right? You may be saying things unknowingly, but that may be hurting that person or causing harm. So we all kind of know what it is, right? It's tendency and inclination or prejudice toward or against something or someone. And these biases are from personal experience or based on your culture, and it could be your institutional culture as well. And there are different types of biases. There are explicit biases that, or cognitive biases that you're aware of, and there are implicit biases that you're unaware of. Which one do you think is more difficult to overcome? Cognitive, explicit, or implicit or unconscious biases? Unconscious, right? Because if you don't know that you have that bias, how are you going to overcome it, right? So it's very important for us to realize that we all have biases, conscious and unconscious. And that just knowing that you have these, accepting these flaws and that you can have unconscious biases is a good starting point for you to make changes. So unconscious bias, it's an attitude or stereotype that unconsciously affect our actions. So you may think that you're perfectly fine and fair, but in reality, there are subtle effects that gets played in your decision making. But biases are not all bad, right? Sometimes they're positive, right? Sometimes they're negative, but the problem is that these impressions or perception is not made based on fact or truth. These biases formed over a lifetime as a result of exposure to direct and indirect messages that we receive. And obviously media plays a huge role on how we form these biases. But again, they're definitely changeable, but it takes time and you have to make an intentional effort and you have to participate in training. Okay, so I will go over what every single biases that I listed mean, but I'm sure you can kind of guess what they mean, right? Like halo biases, it's not a bad thing. You're just you give someone more credit than they deserve because of their reputation or how they're perceived. And I didn't list all of them. There are many other types of biases, and we just have to be aware when we make certain decisions or when we think of things certain way that our decision-making process is not influenced by these biases. So I included this picture because I wanted to tell you about a story or a social experiment. In 1952, the Boston Symphony was looking to diversify its orchestral members, which was predominantly male at the time, 1952, right? So it conducted an experiment where a series of blind auditions were being performed. And for the audition, the musicians would play behind the screen so that the judges wouldn't really be able to see their gender, race, age, nothing. They would just listen to the music that they play. So the whole point of it was, they would give chance to people based on their merit and not based on their appearance or age or gender and things like that. Well, surprisingly, after the first audition, nothing had changed. Most people that passed this audition was still predominantly male. Does anyone know what they did to change that? Yes, very good. I figured somebody probably heard of this experiment. Yes. So they actually made the musicians to take off their shoes because unconsciously, when judges heard women walking into the auditorium on their heel, that played a bias. So when they made all the musicians take their shoes off and play behind the screen, 50% of women actually made the first cut. So you think I'm not the one that has bias. You think you're going to be the front, but there are subtle things that you may pick up without you actually realizing. So again, addressing unconscious bias is much more difficult than conscious bias, partially because unconscious bias is very fast, it's involuntary, and sometimes we're not aware of it. So you have to accept that everyone has bias, conscious and unconscious. And these biases are formed, as you remember, over lifetime of experience. So you're not going to be able to change these biases overnight or quickly. Be realistic. These changes are going to be made small, little bit at a time, but it's definitely something that you can change. Okay, I'm actually another thing that I want to talk to you about is cultural competency and sensitivity, right? When you work in a team and when we celebrate diversity and differences, you want to be culturally sensitive and make sure that you understand the differences. So the biggest thing, somebody mentioned communication as a trait of a great team, which is true. Communication, whatever you do, I think it's important to be able to communicate clearly and well. And we have to understand that not just a language barrier among different cultures, but there are other styles of communication that can be potentially misunderstood or misperceived. So for example, acceptable personal space. So in some culture, right, if you're not really close to each other, you're just unfriendly, right? Whereas in our culture, we have a personal space, right? People want a little bit of distance. Gestures, right, can be different. Eye contact, facial expression, and postures, they can all be perceived differently depending on where you are. So I have this picture of a squeaky wheel and nail that's sticking out. Does anyone know the difference? So in Western culture, right, we say squeaky wheel gets the oil, right? So we want people to be assertive, express your opinions directly, right? And that's how we encourage, right, our children, right? Good communication means you say things clearly, be assertive. Whereas in Asian culture, right, the nail that sticks out gets hammered, right? So you don't necessarily want to be so assertive, because in that culture it could be seen aggressive, right? You may not want to come across directly, right? So when we have a diverse team, right, working together, you need to understand that if somebody doesn't say anything in a meeting or a conference, it may not be that it's not that they're not engaged or they have no opinion. It's just that culturally, maybe they want to kind of keep things to themselves or approach it differently to share their opinions, rather than just, say it in a big meeting or engage in debate or argument. So it's important to understand where everyone in your team comes from. So I included this picture because this essentially suggests or describes what we just talked about, right? The woman in the center, she feels like this other person is not friendly because he's kept going away from her, right? Whereas for him, why is she in my personal space, right? He wants a little bit of personal space. If you see on the left of the diagram, right, in some culture, right, handshaking is the perfectly fine form of greeting. Whereas in some culture, right, handshaking may not be the most polite way to greet someone, where they bow and they give out a name card and things like that. So, of course, in this an age with everything is global, right, with the social media, I think people are likely to understand your intention and where you're coming from. But at the same time, you want to be aware of these cultural differences. Okay, thumbs up. What does thumbs up mean in our culture? It means excellent, right? Good job, great job. But in some culture, it just means number one. That's how they count 1, 2, 3, 4, 5, right? Or it means he's the boss or he's the head person. Or in some culture, it means up yours. So it's not a positive thing, right? So wherever you are, right? If you're not sure, maybe you shouldn't use it, right? Okay, right? In our culture, okay means okay. But in some culture, that means money, like pay me money, or this is how they count 0. Or in some culture, it's a vulgar expression. So wherever you are, right, there's nothing wrong or right about these gestures and expression. It's just part of culture, right? You just want to be aware of it. Okay, so next thing I want to cover is microaggression, because microaggression can be form of implicit bias, right? You say certain things, you do certain things, really not realizing that it's detrimental to people around you or person next to you. So microaggression it's the everyday slight indignities, put downs, and insults that member of marginalized group experiences in their day-to-day interaction with individuals who are often unaware that they have engaged in offensive or demeaning way. So psychologists often compare them to death by 1,000 cuts, right? Because it's a small slight and it may not cause incredible damage, right, by itself, but when they accumulate, you can imagine it can have negative health impact, as well as it can impact team dysfunction, or it can influence your team dynamics and productivity. What do you think about that? Well, the thing is, I don't think, right, the male speaker had any intention of, right, harm or intention of slighting this other runner, right? But the problem is, it's essentially his bias that even though she's American-born citizen, he's keep asking, like, where are you from? Like, as if she's not real American, right? Whereas when she asked him, where are you from? He's like, I'm American, right? So the problem is when these microaggression happens, and again, unfortunately, I think I've said some things that could potentially be considered microaggression. And I think when other people say these things, they don't really think it's anything bad. So it's very important when, as a recipient, right, when you hear something and you feel like it's inappropriate or it's considered microaggression, or it's something that's making you uncomfortable, it's important for you to let them know, because that person may just be ignorant and they just don't know that it was wrong thing or inappropriate things to say. So these interventions against micro-interventions, one of the psychologists termed micro-intervention. So when it happens, sometimes just ask for clarification. Well, could you say a little more about what you mean by that, right? And when you make that person go back and think about what they say, sometimes they have this eureka moment. Okay, well, now that I think about it, maybe I shouldn't have said it that way, or I shouldn't have put it that way, right? Or separate intent from impact, right? Again, in this video, I don't think that person had bad intent for that runner, but the impact from the recipient's standpoint was negative, right? So when things like this happen, you want to point it out so that ignorance stops, right? Because ignorance is not an excuse. Another thing I want to talk about is bullying in workplace or in your team. And we have to clarify that there's a difference between conflict and being bullied, right? Conflict happens at professional level, right? I disagree, I agree to disagree, and we may have differences in opinion. So we can have conflicts, but when it's a bullying, right, there's always imbalance of power, and it's repetitive. You ask them to stop and they may not stop. And it can come in form of verbal, social, or physical form, right? And bullying is actually considered harassment.
Again, this is the USS Montana requesting that you immediately divert your course 15 degrees to the north to avoid a collision. Over. Please divert your course 15 degrees to the south to avoid collision.
This is Captain Hancock. You will divert your course. Over.
Negative, Captain. I'm not moving anything. Change your course. Over.
Sir, this is the USS Montana, the second largest vessel in the North Atlantic Fleet. You will change course 15 degrees north, or I will be forced to take measures to ensure the safety of this ship. Over.
This is a lighthouse, mate. It's your call.
What do you think? Is that considered bullying? Sorry. And depending on level of harassment, it can be at some point unlawful as well. And the thing is, when you watch these harassments, microaggression, or when you hear or see things that you feel uncomfortable, or you realize or you're aware that another person is uncomfortable, then as a recipient or as a bystander, it's our responsibility to intervene, right? Unless these small changes are made, things will perpetuate. And if everyone's not willing to stand up and speak up, then nobody will do it, unfortunately. And it's important to recognize that when one person says or does something, others are more likely to do it. Okay, so you may think that you may say, oh, I would not have stood up. You never know. And the reason I wanted you to this video is it's really, it takes one person to set this new policy or new rule, right? So you can imagine when you're in a group and especially as a bystander, you can be that one person that changes a culture. That's new norm that whatever was happening is not okay. And there are different ways of intervening, obviously. And sometimes it all takes just a very small gesture. I'm gonna go over 4 Ds of intervention. And before you intervene, obviously you wanna make sure that your safety comes first, and your safety is just as important as the situation or event that you're watching. But first D is a direct approach. If you feel safe and if you feel comfortable, you can walk up to the harasser or put yourself into that situation and try to stop. But if you don't feel comfortable, which is totally fine, because I'm not sure I would necessarily feel comfortable intervening directly every time, especially if a physical event, you can distract them. You can just let them know as you're passing by, you can drop things, you can talk on the phone so that those people, whatever situation is happening, it causes a pause, right? Because when the harasser realize that somebody's watching, right, their behavior may change. Or you can delegate. You can go find someone, security if you're at the hospital, or supervisor who can have more power over a situation. The last D is document. We all have our cell phones, right? We can take pictures, we can take videos, which is fine, right? Because you may be able to provide sort of evidentiary support. But one thing I want to emphasize though, when you take these pictures or video, please be mindful of how you use it and do not post them without the victim's consent or the recipient who was being harassed, right? If you post something without their consent, it goes viral and now everyone's watching. The person who was being harassed, they already feel bad, right? They're already disempowered, and having to watch it over and over again can cause more trauma and cause more harm. So when you take pictures, do video, document, it's great, but just be mindful and be courteous of how you use them. And sometimes just walking up to the person and say, hey, are you okay? Is there anything I can do for you? Just that short phrases may be all they need. Okay, briefly, in a couple minutes. Lastly, I want to talk to you about resilience, right? In a great team, as great, motivated, highly driven person, we all have ups and downs, right? But when we face these challenges, problems, difficulties, the lowest of low in your life, what brings you back is resilience, how resilient you are. Resilience is not all or none. It's rather some people may have more resilience and some people have less resilience. It's a capacity to recover from adversities, and it's an acquired skill and learned trait and personality. And I can tell you, surviving my general surgery residency, I can definitely say I became more resilient, right? When we face these more challenging, more difficult situations, and once you make it through it, right, you built that resilient muscle. And people who believe that he or she can find meaningful purpose in life, or a person who has belief that they can influence his or her surroundings and outcomes of the event, or the person that believe positive or negative experience will lead to learning and growth. These people who has these positive beliefs are more likely to be resilient. And the thing about it is, there's no point in trying to control situations that you can't control. Accidents happen, things happen in our lives that you can't really do anything about. But what you can control is how you respond to those events, right? And as you go through and learn how to respond to those difficult circumstances, as you overcome those moments, you're building your resilience muscle. And we all know that not all stress is bad, right? There's a good stress and there's bad stress. The only thing is that when you have this acute eustress, it helps you build your resilience, right? But just remember that chronic stress and distress can cause mental, emotional, physical harm. So you have to, again, be self-aware what you can handle and what you cannot handle. Chronic stress, if you feel like you're experiencing chronic stress and things are out of control, maybe it's time you need to talk to someone, either a colleague, your peer, your mentor, your family or friends, to talk things over. Okay, so I'm going to just pass. I want to mention lastly, specifically about shame resilience, because I think because all very highly driven and motivated, sometimes we experience shame more acutely than maybe some others, right? Professor Brene Brown is a sociology who studies specifically on shame and vulnerability. And it is so true. Shame is this intensely painful feeling or experience of believing that we're flawed and therefore unworthy of love, belonging, and connection. And if you remember previous slides, the sense of belonging in your team, right? Sense of belonging in your family. As a human being, we all want to belong somewhere, and it's an important feeling. And shame kind of counterreacts that. Shame is a widespread, and it can be triggered from many different situations and events. So when you experience this shame, the way you develop resilience is actually just like we discussed coping mechanism with the complication. You recognize that you're experiencing shame or this negative feeling. And in order to move through shame constructively, you reach out, you develop relationships, and you talk to people around you. Because again, sometimes all you need is someone to commiserate together, right? Just someone who's actively listening to my problems, who can give me a pat in the back and say, it's okay. What you're feeling is normal. And by doing that, it is true, right? When you're sharing your shame with other people, you're putting yourself out there, you're making yourself vulnerable. But by doing that, you can form more stronger and meaningful connections, people around you, right? So shame builds this fear and blame and disconnection, right? Once you start blaming other people, it's because within you, you're feeling a sense of shame. But when you move toward empathy through developing your shame resilience, you become courageous, you put yourself out there, sharing your experience, and then compassion and connection comes with it. And so empathy is a hostile environment for shame. And I just want everyone to practice self-kindness, because I think we tend to be a lot more critical on ourselves than other people, right? Things that we can forgive other people, like if I did it, I'm like, oh, Christy Chai, right? It takes much longer for me to forgive myself. So please be kind to yourself and practice common humanity over isolation. Try to cultivate and build relationships. And I can tell you, relationships doesn't just happen, right? You have to make an effort and practice mindfulness rather than over-identification with the event. Right, as physicians, we need to heal ourselves first. And in order to do that, we can't forget about our personal wellness. Again, cultivating relationships, we always need somebody to talk to, right? Either good or bad. Also try to reflect on your thoughts and activities. You know, I don't journal as much, but I used to do a lot more journaling when I was younger, and it's just fun kind of reading my journal entries like 20 years ago, because I can see how immature I was and how much I've grown. So sometimes writing your thoughts down can be helpful, overcoming some of these negative experiences. And spiritual experience, personally, I get a lot out of my faith practice, hope, and strength and purpose, actually. And also self-care. I know we're all busy, and it's sometimes very hard to get enough exercise, sleep, eat right, but it's an important part of taking care of yourself. So in summary, people who understand their value and goals make the team great. In a successful team, people understand everyone is created equal, but everyone is not the same. They celebrate and learn from differences. It takes everyone's effort to create an inclusive diversity and equitable environment. Things just doesn't happen. Somebody has to step up and speak up. And when you do that, everyone feels appreciated and you can have sense of belonging. Again, ignorance is not an excuse. And I think I've made plenty of mistakes on microaggressions, saying things, making assumptions. So, it's It's that. You can't use ignorance, oh, I didn't know, as an excuse. Everyone needs to stand up and speak up, especially if you're a recipient. I know sometimes it's hard to call it out, but unless you do, the other person may never know, right? That what they're saying is either inappropriate or wrong. Resilience is learned and acquired through experiences and events. And self-care and self-awareness is a key to a successful self-growth. So in the end, I just want you to ask yourself why you want to make yourself be the best, and how will you make it happen, and what does it mean to be the best. So the title, making the best of me in a team, it's just a statement. I actually don't have an answer for you, right? Because the best of me could be could conjure different images, right? Some people, it's getting promotions. Some people being the best, right, parent or best boss. Some people having a lot of RVUs, great productivity. Everyone's best is different. So for you, why do you want to be the best? And how will you make it happen? And what does it mean to be the best?